Okay, so you're speaking, but Sue is not speaking.
No, Sue's not speaking. I was delegated to represent her.
Okay, good.
Well, good morning, everyone. I want to start off by thanking the Metro Public Health Department and Dr. Samia Areola for hosting us this morning, the great team here at Lentz Public Health Center. And of course, thank you to everyone for joining us at this week's roundtable. Today, we're here to talk about the progress we are making to keep Nashville safe and how important it is that we work together as a community to build a safer Nashville. The tragic events of this week across the country, like so many things that we have seen that have happened over the last year, include things I never expected to see in my lifetime, and they prompt plenty of reflection on the notion of safety. And I will say I expect our federal government to work with cities, not against them, if the goal is safety for everyone. Every community deserves safety. We don't make our cities safer by dividing people. We make our cities safer by working together. And that's the reason I stand here today to announce a new task force that will guide our work on community safety. In Nashville, we are working together, and it is making our community safer, healthier, and more connected. The top job of government is to keep people safe, and I'm personally committed to safety and affordability as our top priorities. I'm so grateful for the work of the many partners that have contributed to the dramatic declines in crime rates we saw across 2025. Crime in Nashville is down in every category and a 12% overall reduction year over year. It's down in every police precinct across the county. We had robbery and burglary levels drop as low as we've seen since the 1960s, which is remarkable. It's down thanks to the excellent work of the Metro Nashville Police Department and our first responders. But it's also down because of the work of many community partners and neighbors in every part of the city engaging on the topic of safety. Over the past few years, we've strengthened and expanded co-response models, distinguishing better between crisis and crime. And we want Nashvillians leaning into the conversation and taking responsibility for one another to help drive these kinds of results. We all play a part in making Nashville safer. We need many voices, minds, and efforts, expertise, and experience pulling together to keep this momentum into 2026. Because if anyone feels unsafe in our community, it means we have work to do. It means we can and should do more. So today we're announcing the launch of a new community safety task force, a group of Nashvillians who will lead development of a community safety plan. We're going to add a full-time position in our office to support their work. This group will bring together different experiences and expertise and a shared passion for serving community and building a safer Nashville. They're going to help us move closer to the overarching goal, a healthier, safer community where everyone has the resources they need to thrive. Health and safety are so closely linked, and I'm delighted that Dr. Areola and MPHD are engaged to help lead this work. And now I'd like to turn things over to him to talk more about how a safer Nashville is also a healthier one. Dr. Areola, thank you.
Good morning, everyone. Dr. Samia Areola, the Director for the Health Department here. As a reminder, our mission is to protect, to improve, and to sustain the health of everyone who lives, works, plays, or visits Nashville. Community safety is an issue of public health significance in many parts of the United States, including Metro Nashville. It is impacting everyone. It is affecting our children and youth. Every incident that we see is one more child screaming for help. It is one more resident asking for help. So we are very happy to be working with Mayor Freddie O'Connell, understanding that this is an important thing in Nashville. It is a responsibility that we have to create environments in every part of the county that allows everyone to thrive optimally. For us to be sure that we engage and protect everyone, no matter what their age, race, sexual orientation, or socioeconomic status is. Health is very broad. It is impacted by many factors, including economics, housing, transportation, social services, and education. All of this can also impact safety. While we do not fully understand the complex of the different factors that result in increased susceptibility for some, we do know that traumas, ACEs, that's adverse childhood experiences, and other systemic and historical inequities also play a major role. We know that co-occurring mental health conditions include increased susceptibilities to violence. We know that social isolation, low socioeconomic status, low educational achievement are risk factors also. But we also know that there are protective factors. We know that neighborhood affluence, we know that creating conditions around neighborhoods that make them friendlier, we know that having sidewalks, we know that having grocery stores, all of those are protective factors. We know that social connectedness is a protective factor. As I said, access to food, healthy food is important. So our opportunities to be physically active, parks, recreation, all of those are very important, and how obviously better ways of handling stress in the community. So all of these are factors that we can influence, and as I love to say when I hear the mayor talk about the choose how you move and zoning and sidewalks and educational piece, I always say that's working for the health. All of those factors do impact health. Our vision, obviously, at the health department is to create conditions in every part of the county that allows everyone to thrive. And that's really what this is doing. We're very grateful to you, Mayor, for taking this very important step. And my team, as many of them are here, we're looking forward to working with you on this. So when we talk about public health approach to public safety, I do want to just mention what that means. So it's not an abstract term. It means that we have clearly defined goals. It means that we use data to paint the right picture. Those who are impacted, where things are, trends. It means that we look at the root causes and factors that are contributing to those things, especially specific factors that are relevant in Nashville. It means that we use information to guide and to properly define the problems and to select risk reduction strategies that are most likely to work. It means that the assumptions that we use to make those inferences are relevant to the unique situation of Nashvillians. It means that we make data-driven decisions. It means that we track process, we track outputs, and we track outcomes. It means that we provide educational, facilitation, and public outreach activities. It means that we understand it's a collective effort where we bring stakeholders and community members together. It means that we, again, identify risk factors and protective factors that are more useful to Nashville community. So we're very happy that this task force is very broad in terms of knowledge and expertise. We're very happy, again, that the mayor is taking this step. And really, I think this is one of the bigger things that would be more impactful as to the health of Nashville moving forward. So again, one such big player, one such partner, one such important stakeholder who's been working on this for years is our juvenile court clerk, Lionel Matthews, and is one of the co-chairs of this task force, and it's my pleasure to introduce him as the next speaker.
Good morning. I'm excited to be a part of this next phase of community safety alongside so many great community leaders and partners. Our work starts right away with our first meeting coming up on January 15th, right here at the Lentz Public Health Center. This Community Safety Task Force has a tremendous task before it to deliver an actionable community safety plan, in partnership with our residents, but we're starting from a strong foundation. For many decades, our residents and community organizations have been doing the vital work of supporting one another and creating and working to create lasting peace in our neighborhoods. We have representation on this task force from nonprofits, healthcare, philanthropy, advocacy, elected officials, government, universities, schools, and our faith community. Community safety has been a priority of mine for 2 decades, ever since my family experienced tragic personal loss due to gun violence. And I'm lucky to be co-chairing this community safety task force with Sue Ford White, who is going to be a great partner in helping to lead and guide this work. But in that past 2 decades, I have made it a priority to work on public safety in various capacities, whether that was coordinating the 2016 Youth Violence Summit, which resulted in the creation of our Power Youth program and the My Brother's Keeper Nashville Partnership, whether it was working with community advocates to create the new Mayor's Office of Youth Safety, whether it was working with Judge Sheila Calloway to advocate and build the Nashville Youth Campus for Empowerment that will be opening up on next June in 2027. We have done a lot of work in this community. Our collective work is paying off. As the mayor noted, crime is down across the board and homicides are at their lowest level in more than a decade. Our charge now is to lean in, listen, and deliver a community-driven community safety plan to guide our work forward. And because Mayor O'Connell is focused on taking plans to action, how to implement this community safety plan will be part of our work. Nashvillians, we need you at the table. Community engagement is a key part of this effort, and all of Nashville is encouraged to participate in parts of the process. We'll have more on how we can all play a vital role in this effort very soon, but we will be coming to every community and neighborhood in this county to meet, to have conversations, and to contribute to this plan. And now I will turn things back over to Mayor O'Connell.
Well, thank you, Clerk and Co-Chair Matthews, and I think you can see from these two remarkable leaders why they're going to be so deeply invested in this work. So thank you both for your engagement. And then special thanks, too, to our Community Safety Task Force members, a few of whom are here today. If you are on the task force, will you go ahead and raise your hand so reporters know you're here? Thank you, Sue, as a co-chair. Yep, we've got several folks here. Now, I will say I think community safety is one of our quiet foundations of freedom from fear, freedom from violence. What you just heard from Dr. Areola about the approaches that we're going to pursue with this task force, the actions that we're expecting from Clerk Matthews. This is the assurance that when we invest in each other, we create the possibility of a peace that a community can sustain. We also know that cities are not closed systems, and we will always want to ensure that we can apprehend criminals. When we combine our traditional public safety approach with this continued work on broader approaches to community safety, we get a holistic, complementary approach to making Nashville as safe as it can be. So along those lines, we're going to add a crime prevention and violence reduction director in the mayor's office this year. We'll keep uplifting the work of agencies like the Financial Empowerment Center and Metro Action Commission, who are supporting economic mobility for more Nashvillians. We'll keep enrolling new Journey Pass users, extending Nashville's first fare-free transit program for those who need affordable transportation the most. WeGo has already enrolled more than 7,000 residents who've taken more than 300,000 rides so far. We'll keep working with our partners to meet housing demand, like the 233 affordable housing units coming soon to Trinity Lane. We'll keep putting downward pressure on our overdose numbers from opioids, which have been on the decline since 2021. In 2025, we saw an additional 18% reduction in fatal drug overdoses in Davidson County through the end of the third quarter. We will keep investing in mental health co-response in our police and fire departments. On December 1st, the fire department expanded their REACH program to 24/7 staffing for the first time. They served more than 2,500 people last year, and 67% of those served through the REACH program were able to get the help and support they needed without a trip to the emergency department. And that is clear evidence that there is more to safety than policing. Great outcomes begin with great community engagement, and our goal is a safer Nashville. So thanks again to our partners, and of course to you for your engagement on this issue. Together we can build a safer community with better connection points for our residents. And with that, happy to take questions. Yeah.
There was a 6-hour planning commission meeting yesterday, and a lot of it had to do with some recent zoning changes. Metro Council has done a number of them late last year. Where do you stand on those zoning policy changes? And you say you want to make a Nashville work for Nashvillians. Do you think the changes that are already on the table can make this so that can happen?
I do think it can happen, and I think that's where, having served as a district council member, I know that those conversations tend to be most intense, closest to individual neighborhoods and council districts. My understanding is last night it was something that Councilmember Brandon Taylor had brought to the table for the Planning Commission to consider. I knew this too on Metro Council. The mayor's office doesn't usually get involved in individual zoning matters, so I haven't looked at what his specific proposal would do, what the impacts are. Obviously, we're attentive to any time large numbers of residents come out to participate in public hearings, and we try to gauge where public sentiment is on any of those things, but I haven't paid attention to that specific matter.
And I guess, so then a broad question then, a lot of these people, whether it's I did a story on a good list bill one this week for Davidson County Park, of course. They say they're not being heard, and it's not just over there, it's across, your city. Do you see that? Or what do you have to say to that?
I think it's a tough balance, and I think Metro Council I think there are so many points between what the Planning Commission offers, what the Metro Council offers in terms of both public comment and public hearing. There are so many different points of public process. I know as a district council member, and still to this day as mayor, I try to be very present in the community to get community feedback directly. And I've had tough conversations with constituents before that are about that very idea of not being heard. At one point, I actually did say to a woman who was in my home for a community meeting, I said, I'm standing here right now listening to you. What are you concerned that I'm not hearing? And I think that's the tough part, is sometimes you have the conversation, everybody is heard, but you're still going to leave with a decision that leaves some people feeling like they're not heard, but it's really just a function of disagreement. That happens all the time, though. I mean, that's happened for the entire multi-decade existence of Metro, and it will continue to happen. But these conversations like this one that's going to happen with community safety, they will produce tension. They will produce points of both agreement. You'll sometimes even get to consensus, but there will sometimes be points of disagreement as well. That's a natural part of how we do this democratically. Thanks. I'll go back to Stephen, then I'll come back up. It's a good question. I think we want to let the task force first come together. I would love to see something this year. We know that the initial recommendations probably won't come in time for FY27, but we'd like to see what we can incorporate midstream. But we want to be able to use this at the very least for the last budget process of the term. And so similar to Unified Housing Strategy, we kind of got it just in time for a few last-minute opportunities to make recommendations in the budget. We do want this, to Clerk Matthews' point, to be something that is actionable. But I don't have a specific timeline for you yet. Yeah.
With the upcoming legislative session, are there any priorities that you have or fears going into this?
I think we always want to preserve local jurisdictions, and I know Nashville's not alone in this regard. We work with the other big city mayors. I work with peers on the Greater Nashville Regional Council, work with the Tennessee Municipal League. I think generally across the board, we want to preserve our right to govern locally as best we can. So we'll be paying attention to things that might have an element of preemption to them. And I think that's really the biggest concern. I know there will be other specific policy areas. We know that there are a range of issues that I think Nashvillians are going to disagree with, that we've already seen some bills filed, and I think it's going to be up to our Davidson County delegation, who we stay in constant contact with, to continue to address those. I'll come back over in a second, Jerry.
I didn't get back to you, I saw you a couple months ago. The fire department recently vacated their headquarters.
Yep.
In their press release, they said it was to make way for the new headquarters.
Yes.
And then about a month later, the same property was leased to the East Bank Community Development for $100 a month.
Yeah.
Does that seem like a good price for Metro? And then how much did it cost to move their headquarters to the Global Mall, which the headquarters is going to be over on Kennedy?
To me, Jerry, this is a lot of looking at opportunities for efficiency. So first and foremost, they were outgrowing the old headquarters space, which is why we had a long-planned upgrade to the headquarters. That's underway. It's very likely to be at the site of Station 2, where we could have a combined facility close to downtown. And then with that Bridgestone building out at the Global Mall site, I mean, we had been, since the acquisition, paying to keep that empty building kind of up, keeping the water on and so forth. So this actually is reclaiming an existing public space that there wasn't a planned use for previously. So it's a good interim space while we finish that build out. For the EBDA, that's ultimately, you could have set the rent at $1 or $1,000. It's all pass-through money anyway, so I wouldn't say it's a deal for anybody. It's really just a way to create space for an entity that, while independent, is right now, it's funded through Metro money anyway. So it's not really like, you wouldn't think of it in a traditional real estate and rental terms. It's a public entity. Come over here. Yeah, I think the mayor of Minneapolis is closest to it and probably has the best sense of it. I haven't looked at the video, any details of the case. I think what we have started with is just making sure that for our Department of Law, for law enforcement, that we're prepared to understand. That will probably go through an investigation process, and I will never be the person who is seeking to comment first on really complicated matters before we understand them fully. I will say, one of the points of apprehension I've had about federal authorities working without close local coordination is that tragic incidents might be more likely, and I think between Minneapolis and Portland, you have seen some really difficult examples of that recently. I've stayed in touch with Mayor Young in Memphis about what they're dealing with. I think for us in Nashville, we're focused on exactly what we're talking about today. We made important progress on public safety and specifically reductions in overall crime in 2025. We want to continue that progress into 2026, and we want to make sure that our state and federal partners are aware of what we're doing in Nashville to keep the city safe. At the moment, I'm not as concerned about it, but I think we can also be caught by surprise, as we discovered last spring when we did see state troopers and ICE collaborating, and that happened without coordination with us. I'm going to go to Cynthia's behind you too, Alex. You've probably seen that at least some parts of that law don't, even Tennessee's Attorney General doesn't intend to be able to defend those things. We constantly work with our Department of Law to make sure we're both protecting our rights, but also protecting our residents, and so we'll continue to do that. So I'm going to go to Cynthia. I saw her first, and then I'll come right back to you, and then we'll do it. We are still working through a few things. You may have heard we had a kind of a stakeholder engagement session. The overall design of the boulevard, though, we won't get to construction until probably 4 or 5 years from now, and so we're prioritizing the near-term infrastructure investments, Second Street, et cetera, that are underway right now. We're also, again, there may be some near-term impact that we want to make sure we're preserving with the Siegenthaler pedestrian bridge, but we're going to continue to have, a big stakeholder-driven process about final designs, but nothing to announce yet.
Earlier this week, MMP scammer alerting Nashvilleians that there are fake fundraisers they can give their money to. Are you been in contact with police about it? Is there any update on that? Can you give any comments on that?
I appreciate, I'll just say overall, I know that MMPD does multiple levels of security threats, including scam alerts, and I will say I too appreciate the Attorney General's office approach to consumer protection. We try to stay aware of those and try to make Nashvilleians aware of them, so thank you for flagging the issue. It is something I hope people will continue to be aware of. Just because you get a text message about a cause does not mean that you should click on the link and give immediately, and I'd say I would follow that same approach too. If you learn about something, go straight to the source. If there is a cause that you're supporting, you can always go find the authority that is responding to that cause, whether it is a candidate, a nonprofit organization, somebody else, and I would always encourage people to be aware of those points of outreach, especially if it's from a number or a person that you have not heard of, don't know personally, haven't engaged with. You can always go straight to the source. Sure. Okay. We are not final on all of those estimates. We are in close contact with TDOT, with both the CHIME and EBDA teams engaging there. Those 2 points you mentioned, we know are critical points of priority for both our teams and TDOT, and so we're going to continue to collaborate with them. Been encouraged by their willingness to join us and private sector partners on making sure we get all of the infrastructure needs met on the entire East Bank. Thanks, everybody.